NC Counts Coalition, we are a nonprofit 501c3 organization, and we are committed to building a healthy, just, and equitable North Carolina. And we're doing that through cross-sector partnerships that advance systemic solutions for communities facing systemic barriers. And that's going to be our BIPOC communities, immigrant communities, LGBTQ+, low wealth, and other communities across North Carolina. Our organization was actually built to achieve a complete, fair, and accurate 2020 census count for North Carolina. And we mobilized for the 2020 census count like no other operation across the state of North Carolina to make sure that historically undercounted and missed communities were seen in the census.
I had the opportunity to meet Stacy during the census phase of their work, and when COVID happened, also during the census phase, and we were trying to figure out, the Health and Human Services leaders were trying to figure out how best to get vaccines to people all across North Carolina, I immediately thought of Stacy and her team. One of the hardest parts about vaccine uptake was not knowing who was living where to get it when, and when it would work for them to be able to get a vaccination if it's something they weren't instantly interested in doing and comfortable with doing. The NC Counts Coalition was uniquely positioned and is still uniquely positioned to do this kind of work, working with people on the ground in communities who see residents of all North Carolina communities every single day. It wasn't something that they had to adapt to do, they were already doing it.
Given the challenges that governments face, working with the NC Counts Coalition enables us to work more effectively and efficiently to engage community organizations. We believe partnering with communities is key to helping to improve health outcomes. Community-based organizations are located in the communities that they serve. They have existing relationships, they have trust, and they have knowledge. NC Counts Coalition's organizing framework is essential. It's rooted in equity, and it enables those organizations to reduce silos, to maximize the resources that are available to them, and to make sure that voices of diverse communities are incorporated into decisions that are important to the lives and health of communities.
We were regranters, so the state received funds, a federal fund of the COVID-19, relief that happened across the nation, and that grant funding, some of that came to NC Counts Coalition. We were able to fund, I believe, in total, over $5 million in re-granting over the 3-year period. And so it was really exciting because this was an opportunity to fund organizations that were already doing the work. And it allowed us to lift them up to do what they do best, serve their communities, offer resources to their communities, and actually get funding to support doing that work.
We saw a need in the midst of the pandemic to really build a deeper relationship with communities that we began to engage with since the pandemic. A lot of these organizations were local groups that didn't have infrastructure to connect to state level systemic change, and we saw ourselves as a conduit. Through Healthier Together and NC Counts, we were able to coordinate activities among these groups well after COVID, making sure that their communities were responsive to their needs, making sure elected officials understood that the relief, even after COVID, was still necessary, and providing a space for these residents to advocate around issues, even after the news media, politicians stopped talking about the essence of what was essential in those communities.
Very, very successful relationship because we forged great partnerships in the communities with 3 other vendors or nonprofits that we work with. We reached close to 1,000 people who were vaccinated in Black and brown communities that would not have access to both giving them a call, setting up transportation to go help them schedule, following up with them saying, hey, did you get there? Did you have a problem? With the relationship we had with NC Counts as well as the Healthier Together, we were able to secure additional funding like from Uber. So we were able to provide people rides because a lot of our people didn't have rides.
¿Por qué decidimos participar en el programa de comunidades más saludables? Primeramente porque somos una organización nueva, una organización que nació durante la pandemia, en un área muy difícil donde la gente que da las subvenciones no conoce realmente el área que nosotros servimos. Mucha de esa gente piensa que el final del estado es Asheville, y cuando nosotros recibimos el primer acercamiento de comunidades más saludables, fue a través de su representante de la región 1, Angélica Wynn, quien inmediatamente nos ayudó a crear nuestro primer evento. Un evento de vacunación, el cual nos permitió trabajar con más organizaciones que están trabajando ahí en el área. Entonces, desde ese momento, desde esa primera conexión, decidimos que queríamos ser parte de este grupo.
Everybody was scared. Everybody had questions. So we were able to actually learn more about it ourselves and then go out in the community and share that information with everyone.
NC Counts has been a blessing to us. We've been able to serve almost 10,000 meals based on support from NC Counts. We're able to open our facility up, and we were one of the first to provide vaccinations opportunities. We've had over 22 programs there. We've passed out flyers and leaflets to over 3,000 people in the Southeast Raleigh community. So NC Counts and Healthier Together has really been a blessing to Garner Road and those of which we serve.
Al principio no sabíamos lo que estábamos haciendo, pero creo que fue una de las mejores decisiones que hemos tomado, porque el programa de comunidades más saludables cambió el ritmo de nuestra organización True Reach en nuestra área, y conseguimos obtener mucha más confianza de la comunidad. Todavía hoy en día, si necesitan pruebas de COVID, todavía nos llaman para buscar pruebas de COVID. Así que fue una buena elección.
We had the opportunity to work with NC Counts to bring those resources of masks, information, COVID testing. We could even provide things that even the local health departments couldn't provide. So being able to do that as a local grassroots nonprofit organization really empowered us and helped build our capacity to serve.
Cuando nos enteramos que nosotros estábamos haciendo un trabajo en conjunto y no éramos necesariamente personas diferentes, personas LGBTQ, mujeres transgéneros, estábamos todos unidos, estábamos trabajando todos unidos como líderes, como comunidad, y estábamos impactando nosotros esto. O sea, no estábamos siendo segmentados, sino que en la época de la pandemia fuimos uno solo trabajando con NC Count.
Y la comunidad hispana de Carolina del Norte no tiene muchas formas de acceder a la información. Desconoce el idioma, no tiene la suficiente capacidad digital para buscar información, están lejos, en lugares donde muchas veces no hay información en español. Y el reconocimiento de NC Count al valor de la información para mí es muy importante, porque eso a la vez permite ir a otras organizaciones para pedir subsidios, pero con la validación de NC Count.
We're very grateful to NC Count's team for the work that they have done, and we hope to, continue to collaborating with them throughout the years to come.
When we first began this partnership, the support that we received as we were addressing the COVID-19 pandemic, we were able to vaccinate thousands of people at our site. And that's important because the people in our community, some of them had transportation issues. As a matter of fact, we put the word out there, and they came. And they came by taxi, they came by motor vehicle, they came by way of the city bus, they came by way of bicycle, some of them walked, and one day we looked up and we actually saw someone coming to get a COVID-19 vaccine, pushing a grocery shopping cart. When I look at that, I know that what we're doing in the community matters, that it makes a difference when you reach out to help people. And I can't say enough about the support that Healthier Together and NC Counts has provided that has allowed us to accomplish all of these things.
The ability to build that authentic relationship is what permits us to be able to work through the difficult conversations, work through the difficult issues that sometimes arise among collaborations. Because at the end of the day, it's that authentic relationship that reminds us of why we are here, which is to build a stronger, healthier North Carolina.
The Healthier Together initiative has helped prepare my region for future public health challenges by simply building up the confidence of what skills were already there. The community-based organizations in that region and across the state were already capable of amazing things. This initiative simply provided resources, more structure, and connections to amplify what folks are already doing. From this initiative, the confidence has been built, and in the future, I know that these folks will know that they are capable of doing amazing things, even during Public Health Challenge.
Not just the resources, the tangible money, but the actual staffing, the support, the training, the coalition building. All of these things work in effect have made it possible for us to really push in community in a real way. We would not be able to do that without NC Counts. Our teams are working at a local level and at a state level, at a coalition level in ways that I don't think is quite possible without the work of NC Counts. I think there are a lot of organizations that rise and flow in community, but the work of NC Counts, the work of Healthier Together, has been a consistent drumbeat, in particular in rural parts of the state of North Carolina, that we wouldn't be able to reach otherwise. I'm truly thankful for the work of NC Counts. We are grateful for the support of Healthier Together, and we look forward to continuing. It doesn't just happen year after year, but this consistent long-term vision of what we're gonna see only works when we are together, and I'm glad that we're healthier together through NC Counts.
I want to say thank you to everyone who had anything to do with Healthier Together. To the North Carolina Department of Health and Human Services, thank you for taking a chance, for working with a new type of organization. To the community-based organizations that have mobilized under Healthier Together with all of the challenges that we experience together, thank you first for being a partner and a friend of NC Counts Coalition. Thank you for trusting us. Thank you for standing side by side with us throughout the entire Healthier Together initiative. We would not be who we are today if it was not for the work of the community-based organizations we work with and who have allowed us to be an advocate on their behalf. So thank you for trusting us with your organization, with your work, and with your story.